the interventions of choice for when patients are hypomobile or when they are hypomobile. So, in the case of hypermobility, all right, in the case of hypermobility, patients are going to typically present with some type of ligamentous pain. It could be a dull ache on assuming a fixed position, or it can be an excessive range of motion. But what we need to know what to do for hypermobility surrounding or about a particular articulation. All right, so the choice of treatment for hypermobility is most likely going to be stabilization exercises and postural instruction. Postural instruction or postural education. So first, stabilization exercises, look for abnormal posture, educate patients on posture, implement postural exercises, and also manipulation of neighboring joints. All right. So why would we say manipulation of neighboring joints?
Because of the kinetic chain, how it can affect going down.
Okay. So when you're talking about extremities, it could be due to kinetic chain, right? So if the person is hypermobile at the shoulder joint complex, the hypermobility at the shoulder joint complex could be due to hypomobility at the elbow joint complex. And so now they're hypermobile at the shoulder joint complex to compensate for what the elbow joint complex lacks. Does that make sense? So now you have to perform stabilization exercises around the shoulder joint complex, and then you have to come back and do mobility, joint soft tissue work and mobility exercises, range of motion type of exercises at the elbow joint complex. So the same thing can be for the spine. There could be a limitation of, there could be hypermobility. We'll go back to the term hypermobility. There could be hypermobility of the lumbar spine due to hypomobility of the thoracic spine. I mean, you never know, it could be vice versa. Or it could be segmental. There could be a hypomobility or hypermobility at T12 due to a T12 on L1 due to hypomobility of L1 on L2. All right, so follow me. And we'll talk about more of that when we get to the spine course. So we have to know what to do when hypermobility presents itself, because some of our patients may not come with hypomobility. They may come with hypermobility. So we have to know what we need to do in the cases of hypermobility. Typically, the causes of hypermobility could be genetic causes. For what I mean by genetic, someone who has Down syndrome. So typically, those with Down syndrome are very, very hypermobile. So if you see a patient with Down syndrome and they're very hypomobile, all of their joints are hypomobile. They're hypomobile throughout the body. So what are you going to do with those patients? You're going to work on stability, stabilization. All right, try to make them more stable. All right, they may have some postural abnormalities, and you have to work on their posture. So those are the type of things you're going to be doing with someone who has Down syndrome. Ehlers syndrome is something else where patients present with hypermobility. They have hypermobile connective tissue, hypermobile joints. So there's another group of patients who may present with hypermobility at all of their joints, the spine. They're just hypermobile everywhere. And so those are your type of patients who are going to most likely benefit also from stabilization training. All right. So you need to know this content when you see case questions, when you see clinical questions. You can see questions like, that revolve about this content on a National Physical Therapy exam. So you know if you see someone that is presented with hypermobility, then you know joint mobilization in soft tissue may not be the best answer choices if stabilization type of training is within the answer choices. Does this make sense? Okay, so this right here primes your thinking and how we need to be clinical reasoning as therapists in the clinic. So you need to have a strong command of this content here, you know, when to treat.
Also may see in documentation, and I'm seeing it a lot more often, biting index, or a biting score, BEIGHTON. You all know what that is? Okay, it's a quick screen that they do, and they'll classify people, their mobility based on certain things. So like, there's nine things that they check. Alright, so there's 9 things they check, you'll see me? So they'll look at finger, pinky finger. Can you bend your pinky finger, 5th digit, okay, past 90 degrees, right? You seeing it? Okay. Have y'all learned this in another class? Okay, alright. Thumb to the forearm, right? I have a high bite because I am hypermobile. So my thumb will contact the front of my forearm. Right, so this is 1, 2, 3, 4, elbow hyperextension, okay? 5, 6, knee hyperextension, 7, 8, and then they'll look to see if a person can bend forward and put their palms flat on the floor, and that would be 9. And so you'll see they'll classify hypermobility with that. But I'm starting to see that a lot more. Every time my daughter goes to a different doctor, that's one of the things they check.
In cases where patients are hypomobile, with hypomobility, our line of treatment is soft tissue manipulation, joint manipulation, followed by supporting interventions in the cases of hypomobility. So where are the cases that are deemed hypomobile? Cases of stiffness, cases of a painful entrapment, cases of mechanical locking, and cases of arthrosis, like osteoarthritis, rheumatoid arthritis. So these are cases where you may have synovial joint dysfunction that presents itself as hypomobility. That's decreased soft tissue mobility, decreased joint mobility. So if we have those cases to where someone is hypomobile, then your line of treatment being soft tissue, joint molds, followed by supporting interventions, okay? And you can incorporate your modalities to help with those conditions as well. Modalities like Morse heat pack, infrared heat, ultrasound for thermal effects, etc. Okay. I want to present to you and let you know the difference of the intervention school of thought when it comes to patients with hypomobility and when it comes to patients with hypermobility. Okay, you're gonna see that information and content again. So does that make sense?